Dr. Heather, and today I actually want to talk to you guys about TMJ. So one of my very good clients, patients, she had mentioned she's been having some TMJ discomfort. So I figured let's make a short video on what it is and things you could do at home to really kind of help alleviate that TMJ. So like always, I want to start first with going over the anatomy so you guys have a better understanding of the TMJ, what it is, and kind of what contributes to our TMJ for becoming inflamed and irritated. So like always, I have my friend Mr. Super Skeleton here. We're going to use him as the demonstration model for all intents and purposes. And as always, anything that I use in the videos, you can always find links down below. And if you are a current subscriber, thank you always for subscribing. And if you haven't subscribed yet to the channel, please do click that lovely link right there above and subscribe today. So like I said, we want to talk about the TMJ first. This is known as our temporomandibular joint. A lot of times, we will get symptoms like locked jaw, and that's because the TMJ joint itself has become locked up. So if we were to take a look at anatomy, everyone, I want to point out a few things. So here's our skull right here. So here's the base of the skull. This is actually our occipital bone right here. You can see this nice little bony tuberance that's coming off. And if we go over here, right where the mandible is, that's your actual jawbone, you're going to see there's a little joint surface right up in here. That's actually known as your TMJ. That's where the temporomandibular, so here's your temporal bone, mandibular, okay, so that's that mandible, that's that jawbone right here. That's where they make that connection. So a lot of times when we look at people who are suffering with TMJ issues, it's, they'll notice like clicking, popping on that one side. They could also notice that maybe they're having some kind of more clogging kind of feeling in that ear, or they're actually, TMJ could lead to some headaches because your suboccipital muscles, which do sit over here on that back side, could become very tender, very tight on that one side, leading to some restriction of blood flow and so forth, creating kind of a headache sensation happening. So with this understanding, we know that the TMJ joint itself is a hinge joint, okay? And as a sports chiropractor, when people come in complaining about TMJ issues, we'll take a look at the suboccipital muscles, your first cervical vertebrae known as your atlas, and then also to the jawbone itself. So when we're looking at stuff like this, and if I was to make the guy's mouth kind of open and close, you can see that joint movement pattern happening. A lot of times we'll notice this discomfort when we're chewing, when we're opening our mouth. Sometimes it can happen if we're grinding our teeth very much, in sleep. So one recommendation would be to kind of get like one of those night guards, or if you're a hockey player, you put one of those mouth guards in place, and you could use that to kind of help relax this area from getting really over irritated from grinding the teeth, at night when you sleep. So with that being said, the other thing we could do is we could look at doing some soft tissue work to our actual muscles of mastication. You could start on the outer surface, or you could actually take your finger and go inside and start massaging the inside of the musculature there as well. Some other things that you can do will obviously be some soft tissue release, which we're going to go through using a foam roller. And there are some just nice gentle stretches you could do to your traps. Again, stuff that we're going to go over a little bit more in the video coming up next. So like I said, guys, if you're having that TMJ irritation, the three areas that you do want to address are not just the TMJ joint itself, the first vertebra, which is known as your atlas, your suboccipital muscles here. And like I said, we're going to address those traps as well, because they do originate here at the base of the skull and then come down. And that could just be adding some extra tension and stress to that area, which we want to address. Okay, so like I said, the first thing we want to do is work on the soft tissue. So we're going to go ahead and head over to our foam roller next. Okay, so we've gone ahead and we've done some actual massage work to our, for our TMJ. We've gone ahead, we started to massage out our muscles of mastication, which is all of these guys right in this zone. And like I said, again, you could actually go inside the mouth too as well, do some little massage work there. But now what we want to do is we want to start addressing, like I said, those suboccipital muscles, and we even want to start addressing your trap muscles a little bit more. So we want to make sure there's no tension on the back side as well. That could be creating some pulling action on that actual TMJ joint, creating more of that locked jaw feeling or that clicking and popping that you're hearing when chewing or opening and closing your mouth. So the first thing what we're going to do is we're going to come down onto our roller. We're going to place the roller actually at the base of the neck. And what we're going to do is we're going to actually extend the head back a little bit. We're going to apply some pressure into the area, and then we're going to rock the head from side to side, allowing for that suboccipital area to really kind of get massaged out. So guys, grab your roller. And if you haven't gone ahead and gotten a roller, I have left some links down below too. So if you need access to anything that you see demoed in the video, please do go ahead and click on some of the links below. All right, so first thing first, let's come down onto our roller. We're gonna sit onto the floor, and then we're gonna go ahead and nice and easy, we're gonna place our neck right on the roller, okay? So here I have my neck on the roller. I'm adding a little bit of pressure by pushing my skull back and down onto the roller where I can feel some of those little bits of trigger points. From here, what I'm going to do is, if my nose is 12 o'clock, I'm going to look to 9, and then I'm going to come back to noon, and I'm going to look over to 3 o'clock. So what I'm trying to do is actually massage out those suboccipital muscles, really trying to get into that area right there. Now, if your roller does have some nodules on it, you may feel this a little bit more because those nodules will get into that area just a little bit further. Okay, so right there, we've done our suboccipitals. The next thing what we could do is, in using our roller, is we could come up a little higher. So now what we're going to do is we're going to place the roller more towards the scapula area, and we're going to come up and we're going to try to just get into that upper trap area right at the spine of the scapula, which is just that little bit of bone that you can feel when you're coming off that area from side to side. So again, you could use the roller in those two ways to go ahead and start breaking down the tissue to allow for that TMJ joint to stop feeling so engaged, so inflamed. Now the next thing we want to look at is doing a few stretches. So there are some basic stretches that you can do at home to help out with that TMJ joint, and that's going to be really addressing your traps. So the first one, we all know these just from basic PT, skills, is we're going to go ahead and we're going to bring our ear to our shoulder. So we're going to just nice and easy drop the head to the shoulder. You don't want to allow for rotation, so try to keep that chin facing forward and just hold here. You want to feel the shoulder on the opposite side dropping down. You could take the same side hand, bring it so that the middle finger does match up with the ear, and gently press, pulling the head over to the side, trying to get into stretching out that trap a little further. Now, if you're still not feeling it quite as much, you could bring the ear to the chest, turn the head slightly, allowing now for that trap to even get under more tension, applying some pressure by placing the hand to the back of the neck and stretching out a little further here. So that's what you could do on both sides, just to kind of allow for that stretch to happen a little further into that trap muscle. Now, there is one other stretch that you could do, and that would be utilizing your TRX. So now we want to go ahead and use our TRX to stretch out our trap just a little bit further to try to get everything to relax a little bit more. Now, the nice easy one that you could do first is just simply going ahead and allowing yourself to just hinge and dropping chin to chest and allowing for the scaps to really stretch out in this position. Now, you may not feel the traps really stretch out, but you will start to feel, the scapulas move out to the side and feeling some really good stretch there as well. The next one that you could do is take both handles, overlay them just like so, and then just nice and easy, taking your hand, one hand, bringing it here, and just trying to bring your ear to the opposite bicep, allowing for this arm to pull down. And what you're doing is you're allowing for some resistance with that TRX. You're just kind of cradling that head in there, trying to allow for some stretch to happen here in this position. Now, the other one that you could do is you could go ahead and just let your body fall, all right? And just allowing for the, again, back of the scapula to stretch out further as well. Again, trying to get a little bit down further into the trap muscle, because there are 3 areas of the trap, the upper, the mid, and the lower. So you could try to hit all 3. But again, like I said, you take the hands, place them on top of the head, drop the ear to the shoulder, and then from there, you're trying to go ahead, use the resistance of the TRX to apply a little bit of resistance as you go ahead and just allowing for a nice gentle stretch to happen in this zone here. So like I said, those are just a few extra stretches that you could do to kind of stretch out the traps to help kind of alleviate that TMJ discomfort. The best thing to do when you do have TMJ, like I said, get that night guard, then look at really massaging out the muscles of mastication. That's going to make the biggest difference, and then going ahead and working out the suboccipitals. If you do need further intervention, I would suggest, if you have a good chiropractor in town, to go see them, get that adjusted, because that will help as well. But those are just some easy home remedies that you can do to alleviate that TMJ. And if you found some of the content today valuable, please do hit the like button. And as always, if you're feeling like your TMJ also is coming on because your traps are getting too tight, thanks to some of the lifting moves that you're doing, do check out my video on neck pain and lifting to kind of help give you guys some more suggestions on things you can do to really relieve the tension further in the traps on both sides of the neck. All right, guys, like I said, this is Dr. Heather. Thanks for watching. And if you haven't subscribed, please do go ahead and subscribe today. Talk to you all soon.